Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, over-the-counter eardrops for ear infections and more. Over-the-counter, OTC, eardrops are used to treat ear infections and other common conditions like swimmer's ear. The eardrops can be a helpful remedy to relieve symptoms of earwax buildup. /r/n/r/n with ear infections. However, your healthcare provider may decide to treat you with prescription eardrops or other therapies. Antibiotic and steroid drops are examples used in bullous myringitis, infection of the eardrum. You also may need another condition diagnosed, such as eustachian tube, auditory tube, dysfunction. /r/n/r/n illustration by Jiaqi Zhou for Verywell Health/r/n/r/n Swimmers ear, also known as otitis externa, is an outer ear infection that affects the ear canal. The condition is caused by water that gets trapped in the ear, a lack of protective earwax, and injury to the ear canal. /r/n/r/n The glycerin or isopropyl alcohol in swimmer's ear drops combines with the water in the ear. The water-alcohol combination then evaporates, drying out the ear. This relieves symptoms of /r/n/r/n Prescription ear drops are sometimes used by people with swimmer's ear if the infection requires antibiotic treatment, but OTC ear drops may be used to help dry out the ears quicker. /r/n/r/n If symptoms continue to persist or become worse after using an OTC ear drop for swimmer's ear, see a healthcare provider since a prescription is likely needed. /r/n/r/n Using ear drops properly will require you to lie down on your side with the affected ear facing the ceiling. Once you administer the drops, stay lying in that position for 3 to 5 minutes. /r/n/r/n Anesthetic ear drops can help alleviate pain and swelling caused by ear infections with ingredients that can include lidocaine hydrochloride, found in the Polysporin Plus brand. They aren't often recommended, though, because they do not treat the infection, and other OTC pain relievers can be used, such as Tylenol, acetaminophen, or Advil, ibuprofen. /r/n/r/n According to the Food and Drug Administration, these prescription ear drops should only be used after a careful and thorough evaluation of the included ingredients. This is because they have not been verified as safe and effective for everyday use for ear pain and swelling due to ear infections. /r/n/r/n Ingredients that have been shown to cause adverse reactions include /r/n/r/n If you are experiencing ear pain and think you may have an ear infection, the best thing to do is to use an approved OTC oral pain reliever. /r/n/r/n Over-the-counter ear drops can help to relieve symptoms that include ear pain, hearing loss, itching and infection, or ringing in the ears, tinnitus. Some popular OTC ear drops include /r/n/r/n Read the directions and ingredient list carefully and speak to a healthcare provider or pharmacist if you are unsure which ear drops are right for you. /r/n/r/n OTC ear drops are either water or oil based. Ingredients typically found in earwax removal drops include /r/n/r/n Although ear drops can be helpful in the removal of built-up earwax, there can be side effects. People with sensitive skin may experience irritation of the skin in and around the ear canal. Therefore, they should be used sparingly and only as directed. /r/n/r/n You can try a home remedy like hydrogen peroxide for earwax removal. But home remedies are not recommended when dealing with ear infections. There's no proof of benefit and you should avoid using essential oils or other products as eardrops. /r/n/r/n In some situations, you should avoid using OTC ear drops. These include /r/n/r/n Causes of a middle ear infection, otitis media, include eustachian tube blockage. If the eustachian tube becomes blocked by swollen adenoids, any fluid and bacteria trapped inside can lead to an infection. Bacterial causes include Streptococcus pneumoniae and Haemophilus influenza. The common cold and influenza, flu, can lead to a viral middle ear infection. r/n/r/n over-the-counter ear drops used to treat ear conditions may be effective, but not always. You should reach out to your healthcare provider if your symptoms don't improve or get worse over 2 to 3 days. /r/n/r/n Your provider can diagnose and treat your condition, often by using prescription ear drops. With swimmer's ear, for example, most people will feel better in about 3 days but use the drops for at least 7 days. Notify your provider if you still have symptoms after a week. /r/n/r/n Some infections will go away in a few days' time, but you may need to see a healthcare provider if symptoms persist. Your provider can diagnose the cause and severity of the infection and prescribe the appropriate antifungal antibacterial ear drops. OTC ear drops may help relieve symptoms but they will not treat the infection itself. /r/n/r/n Seek care immediately if you experience /r/n/r/n Other symptoms that require immediate attention include hives, which can suggest an allergic response, difficulty breathing, and dizziness. /r/n/r/n Sign up for our Health Tip of the Day newsletter, and receive daily tips that will help you live your healthiest life. /r/n/r/n Thank you. Form.email, for signing up. /r/n/r/n There was an error. Please try again. /r/n/r/n Over-the-counter drops can help treat several health issues affecting the ear. They are generally safe and effective, though not all drops are helpful in all cases. Anesthetic ear drops, for example, may not offer pain relief as well as common oral OTC medications do. /r/n/r/n You may need to see a healthcare provider for diagnosis and treatment. Your provider can offer prescription ear drops used for infections or other antibiotic or steroid medications if necessary. /r/n/r/n When using OTC ear drops, the technique must be kept in mind. Make sure you wash your hands beforehand and that the ear drops are at a comfortable temperature. Follow the instructions on the product, but don't hesitate to reach out to a healthcare provider for more guidance. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.